This is Caleb Burgess's research review for BIOL1900 assessment. Firstly, the search strategy I used was the advanced search function in UQ Library Resources. In that menu, you are able to specify words to search for. I searched for the words physical exercise, depression, anxiety, and adolescence. In the search function, I also required the phrase randomized controlled trial to be included to be sure that this type of article would be included. When I searched for this, the first article that came up was exactly the topic I was looking for. Therefore, the article I have chosen for this investigation is Impact of Physical Exercise on Depression and Anxiety in Adolescent Inpatients, a randomized controlled trial. The article is from UQ Library Resources, which is known to be a reputable source of information. Additionally, the type of trial this article used was randomized controlled trials, RCTs. RCTs are one of the most reliable trials as they are impacted by the least number of controlled variables. RCTs are prospective studies that test the effectiveness of a new intervention or treatment. The articles focus on how depression and anxiety are severe mental health conditions in teenagers, which can lead to long-term disability. While physical activity is proven to reduce depression in adults, it is less clear for hospitalized teenagers. In this randomized controlled trial, the question is raised whether structured physical activity can reduce depressive and anxiety symptoms in adolescent psychiatric inpatients. With the help of research in this field, the potential for exercise as an adjunct of treatment in psychiatry, emphasizing a role in mental health care in adolescents. Long-term impact and wider generalization need to be assessed in future studies. From this information, it can be read that the question the article is trying to answer is the following. Does structured physical exercise integrated into psychiatric hospitalization effectively reduce depression and anxiety symptoms in adolescent inpatients? Thus, to effectively answer this, the article conducted an RCT, which included 52 adolescent inpatients, which were randomly assigned to a physical exercise or control programming 3 to 4 times a week for 6 weeks, 20 hours in total. The primary of testing was the Hospitalized Anxiety Depression Scale, HADS, measuring symptoms of depression and anxiety. Secondary tests were also conducted for reliability. These were psychological self-ratings, diagnostic interviews, and physical self-checks. The study found that structured exercise reduces depressive symptoms in adolescent psychiatric inpatients, but doesn't reduce anxiety symptoms. The exercise group had a 33.8 reduction on the HADS-D scale compared to 0.7 in the control group, so clear benefit for depression management. The exercise group also showed improved cardiovascular fitness, VO2 max increased from 25.3 to 28.5, while the control group showed a decline of VO2 max dropped from 25.5 to 23.8. Enjoyment and adherence rates were high, so the assumption that depressed adolescents can't do physical activity is challenged, but no difference in anxiety reduction between the two groups. The findings show exercise as a useful adjunct to depression treatment, so mental health professionals should include structured exercise in treatment plans. Hospitals and psychiatric units should add supervised physical activity to therapy and medication to get better mental and physical health outcomes. Schools and community centers can use this to develop preventative interventions and offer structured exercise programs for at-risk adolescents to prevent mental health issues before hospitalization is needed. Exercise didn't reduce anxiety, so future research should look into personalized interventions for excess anxiety symptoms, maybe mindfulness-based movement therapies. The high participation and enjoyment rates show that depressed adolescents can do structured physical activity, so motivation isn't the barrier. The study suggests an interconnected approach to adolescent mental health, where exercise is not just an add-on, but part of the treatment. Future research should look into long-term effects and refine interventions for wider applicability. The study has some additional limitations. The small sample size, 52, means no statistical power and no subgroups. 6 weeks is not long enough to see long-term effects on exercise on mental health. Exercise reduced depression but not anxiety, so we need tailored interventions. Hospital setting means results not applicable to outpatient care. There may be selection bias, as those who volunteered may have been more motivated to or predisposed to benefit from physical activity. Despite these limitations, the study gives us some insight into exercise-based interventions in adolescent psychiatric care. Therefore, in conclusion, the RCT by the researchers looked at whether the structured exercise would reduce depression and anxiety in adolescent inpatients. They found depression reduced the HADSD scale by 3.8 in the exercise group and 0.7 in the control group, but had no effect on anxiety. Cardiovascular health improved in the exercise group. Exercise is an adjunct therapy for depression, but more research is needed on long-term and anxiety-specific interventions. Also, due to the small sample size and short duration, more research is needed for outpatient care.